Unless the glasses can perform miracles, don't pay more than you have to.
Good morning and welcome to Newsmakers. I'm Chris May. When Joe Biden left the Senate to become vice president, the appointment went to someone who has worked with him closely for many years. Delaware Senator Ted Kaufman was a volunteer in Joe Biden's first Senate campaign in 1972 and was the senator's chief of staff for more than 20 years. The former DuPont engineer has also been a lecturer at Duke University School of Law. Senator Kaufman serves on both the Judiciary and Foreign Relations Committees, and we are pleased to have him this morning on Newsmakers. Senator, thanks for being here.
Hey, Chris, thanks for having me.
Well, this week marked the one-year anniversary of the signing of the American Reinvestment and Recovery Act, or the stimulus, as is popularly known. The president spoke about its merits on Wednesday and said that it had rescued the economy from a crisis. What do you believe has been the practical effect of the stimulus?
Oh, I think it has rescued us. I mean, when you go back to where we were a year ago, we were losing 730,000 jobs a month. I just finished up the book Too Big to Fail, where just laid out in stark terms where we were a year ago in terms of sliding almost into a depression. We had a $2 trillion hole in our economy, and therefore you needed to fill that hole. That's just basic. It's not just Keynesian economics, that's everybody's economics. And we came up with a bill, the Recovery Act, which had $876 billion to fill a $2 trillion hole. So really that is what we had to do. And to look at it, look at where we are today with the gross domestic product for the last quarter of last year up 5%, with jobs going from losing 730,000 a month to 20,000 a month. It's been pretty dramatic what the change has been, and I give a lot of the credit to the Recovery Act.
Jobs, I think, is the key metric for everyday people.
Yeah.
The president said on Wednesday that it had saved or created around $2 million. Some people dispute those numbers. Do you believe those numbers?
Well, I don't know. 2 million, 3 million, 1 million. I think the key point here is that, and this is the bad news, and that is again, those that don't study history are doomed to repeat it. Go back and look at history. Every recession or depression we've had, jobs lag the economy. So what we created now, this was not a program just to create jobs at the time. This is a program to get the economy moving again. Once the economy moves, the jobs will come back. If we were sitting here right now and gross domestic product was flat, which is what the best estimates would have been if we had not done the Recovery Act, then you don't know when jobs are going to come back. Remember, Japan didn't take this approach. They didn't invest a lot of money. 10 years they had no growth in gross domestic product. So we needed to do something to get the gross domestic product back. As the economy moves up, jobs move up, but unfortunately they move behind it. So I think the key thing is get the economy moving, stock markets back up, the gross domestic products back up. So and you can see that things are going to follow with the jobs. But it's awful. I mean, my number one job for my 2 years here is jobs. So we've got to do a lot of other things, and we've done other things. But the key is getting the economy moving again.
The president did promise the country when he promoted the stimulus in his speech of January 8th of 2009 that it would immediately jumpstart job creation and long-term growth. The unemployment rate is 9.7%, 9% in Delaware. And the CBS News poll has found that just 6% of people believe that it has created jobs. Were expectations perhaps raised a little bit too high?
I think maybe, in order to get it passed. Remember the environment at that time. The Republicans had already announced they weren't going to vote for it. So you had to do something to get this thing moving and get the moderate Democrats on. And I think it was a fair estimate of what happened. I think even as deep as the hole one was, none of us had any idea how deep it was. It wasn't that it didn't do what it was supposed to do. It's just that we kept going down. We got in a deeper hole. Just think of the hole we were in a year ago. So with that, trying to pass a bill where you know that you're not going to get any Republican support. We had like 3 votes in the Senate, I think 1 vote in the House. You have to have a bill that gets things moving again. But I have no doubt, looking back on it, the key to the fact that we're moving where we are today is passing the Recovery Act. And I think just about 90% of the economists, if asked, would say that's what we should have done.
When do you expect, though, that we will see real, robust job growth?
Gosh, you just don't know. I mean, I'm just thankful. I didn't think we'd be, in terms of the economy, frankly, I didn't think we'd be this well off at this point. So it's coming back. I mean, the fact that gross domestic product in the last quarter last year was up as much as it was is a good sign. It's all a good sign. But this is like asking someone that's just had a heart transplant, when are they going to be able to play tennis? I mean, I got my heart transplant. I'm getting up. I can walk around the room a little bit. But I don't know if I'm quite ready to play tennis. And the big thing we got to watch for, Chris, which is in the Economic Recovery Act more, is what do we do when we get to the point where we do start coming out? How do we get out of this thing? Because most of our growth over the last 10 years has been in housing, consumer products or finance. Those are not the jobs that are going to take us out. So we have to have a firm program for science, technology, and engineering, math, in order to move and get these green jobs and high-energy jobs, which we're going to have to compete with around the world. So this is like a two-step process. First, we got to get out of the hole, and then we get out of the hole. It isn't going to be business as usual. We're not going to have a housing boom. We're not going to have, consumer product boom. Americans are thinking carefully about what they're spending. So the big thing is, what do we do next to get out of it? And that's what I'm working on. That's what the president's working on, and hopefully we can get that going.
Okay, so if you knew a year ago what you knew now, you would still cast the same vote for this $787 billion package.
And by the way, I would. And if there was anything that I would have said that I think is right, maybe it should have been a little bigger. Political reality is we couldn't have gotten any bigger. But the fact of the matter is, looking back on it, I would have put more money into it.
Okay, let's talk about another big vote that may be coming up soon in the Senate, and that's on health care.
Yes.
There's been a lot of discussion about using a budgetary maneuver called reconciliation to get the bill that is now in the House through the Senate. It would only require 51 votes, so you'd be able to avoid a GOP filibuster. Do you support using reconciliation to get a bill to the president's desk?
Look, I was there in early mid-70s when we passed the budget bill. Right after that, Senator Byrd introduced what they call the Byrd Rule with reconciliation. The Byrd Rule under reconciliation says you cannot do anything in the reconciliation bill that's about policy. It all has to be either about cutting costs or increasing revenue. It can't be about policy. So the way this bill, the reason why people make the mistake, they say, well, Bush got the tax cuts passed on reconciliation. That was a tax bill. That was fair on reconciliation. What would happen if you tried to pass a bill like the one we have now? Literally, you go to the parliamentarian in the Senate. The parliamentarian in the Senate would take a line, and he or she would go through the thing and take out everything that had to do with policy. And you end up with a bill that really was like Swiss cheese. So when people talk about reconciliation, it have to be a very special situation under whether it be done. I don't think reconciliation is the answer. I told my wife the day after Massachusetts, I said, thank God I'm not president, and thank God the president's not calling me and asking me what to do about health care reform, because I don't have any idea. This is a real, something's got to change in the dynamic. I think the president's smart to kind of lay back in the Congress, because there's lots of people in this country that understand what's in this health care bill, not what's on the bumper stickers, not what's on the 5-second slogans. This is really something that could begin to affect costs. And if we don't affect costs of health care, people talk about deficits, they haven't seen the deficits. Because one of the major costs of deficits is Medicare and Medicare costs that are going just like this. They talk about bending the cost curve, we have to bend the cost curve. You can't bend the cost curve of Medicare and Medicare unless you get health care costs under control. I said from the first time we started about health care reform, number one job in health care reform, I care about the 31 million people that don't have insurance. The number one job in health care is you got to get costs down. We've done it with this bill. It cuts the deficit by $130 billion in the first 10 years, over $1 trillion in the next 10 years. The biggest deficit, second biggest deficit reduction package in the history of the country. Now, most Americans don't understand. They hear an $800 billion bill and they think that's the cost of the bill. That is the cost of the bill, but there are savings and tax increases in the bill that make up for that. So basically, you save $130 billion in the first 10 years.
So you don't support the idea of using reconciliation, but if it comes to a vote through reconciliation, how will you vote?
Well, it depends a lot on what it is. I'm hard-pressed to figure out how it could come to a vote, why I'd want to vote for anything in the reconciliation, because if there's nothing in it, what I'm concerned about is the policy. I'm concerned about how are we going to bring these costs down? What are the policy changes we're going to make? How are we going to change things? For instance, there's a piece of the bill that most people don't even realize. Right now, in your health insurance, if you're the average person in America, you put in, for every $100 you put in, $40 goes for administrative and salaries, and $60 goes to pay for health benefits. This bill mandates that, I think it's 2014, that 85 cents on every dollar that you put into health care goes to actually go for health care. That's the way to bring health care costs down. That, under reconciliation, we cannot do that. So I'm not trying to parse it or anything like that. I want health care reform so bad, because this is not the perfect bill, but let me tell you something. Any bill we pass is better than the present system. Just to give you one number that I kind of always hang on to. Right now in Delaware, the average family of four pays $13,000 for their health insurance. 2016, everybody's estimate, $29,000. American people cannot spend it. 61% of the bankruptcies in the country right now are caused by health care, and of those, 75% of the people have health insurance. We're going to either, if we don't change the way we're doing it, we're going to bankrupt the country. At the same time, we're going to bankrupt millions of Americans if we don't do something about it. So it isn't this bill's perfect, but it's so much better than the present system.
Okay, our time is flying by. Let's talk a little bit of politics before we have to leave. You said when you were first appointed you would not run for a full term in the Senate. It was expected that Beau Biden would step forward and run for the Democrats. He's opted out. Have you thought about changing your mind?
No, because look, basic thing for me is, first off, I'm at a different point in my life. I mean, but the big thing is, if I said I want to run for re-election, I would have spent these 2 years when I was a United States Senator, not being a United States Senator, I'd be a candidate. 65 to 70, I've been through these Senate campaigns. 65 to 70% of my time would have been raising money for my campaign, getting my campaign organized. This is my 2 years to be a United States Senator. I want to be a United States. I think I've been able to do. Let me put it this way: I've been able to do a lot more in this first year than I ever thought I could do. I see great opportunity to do a lot of no big thing. I'm not, but just things that when I'm done, I can say, hey, you made a difference while you were down there. That's a big thing. If I was running for office, I'd be spending all my time raising money and organizing my campaign, not doing that.
Is there a Democrat in Delaware who can beat Mike Castle?
Oh yeah, absolutely. There's our Newcastle County executive. Newcastle County covers 2/3 of the state. A fellow named Chris Coons. He's going to run. He's going to be a great candidate. He's graduated Yale Divinity School, Yale Law School. He knows these issues. One of the smartest guys. This is without exaggeration. He's one of the smartest guys I've met in politics. He'll be a great candidate. Mike Castle's tough. But I'm going to tell you, in Delaware, they did a survey, public policy just did a survey. They asked people, how do you feel about congressional Democrats? And 44% said they approved, 42% they disapproved. They asked them, how do you feel about congressional Republicans? 27% approved, 54% disapproved. So there's a lot of noise out there about how the Democrats. Every poll I've seen, people are upset with the Democrats in Congress. They're even more upset with the Republicans in Congress. So there's an opportunity there. But Mike Castle's really a class guy. He's a good guy. His wife used to work in Senator Biden's office, to let you know how small a state it is. So I know Mike well. But no, Chris Coons, I think Chris Coons can win.
Well, we will be watching that race closely, and we know that your contributions will continue to our political system. Senator, thank you so much for being with us this morning.
Thanks for having me.
It was a real pleasure. Thank you very much. Our guest on Newsmakers has been U.S. Senator Ted Kaufman of Delaware. Newsmakers returns next Sunday at this same time, and you can watch us anytime on CBS3.com. I'm Chris May. Now back to the anchor desk.
Thank you, Chris. Well, coming up in our next half hour, we'll have a look back at the life of former Chief of Staff Alexander Payne.